This is Linda Snetselaar, the Editor-in-Chief of the Journal of the Academy of Nutrition and Dietetics, and I am pleased to have with me this morning for our podcast, Phil Gleason. Phil Gleason is a Senior Fellow at Mathematica Policy Research, and he will be talking to us today about Bayesian decision making. And Phil, thank you so much for being with us today.
You're welcome, Linda. Good to be here.
So my first question is certainly related to the concept of what we think about today in terms of Bayesian decision making. And what I wondered was, could you generally describe for us the philosophy behind Bayesian decision making?
Sure. So it's all about what people do when they make decisions. So when they do that, they generally base a decision on the likelihood that it'll lead to a good or successful outcome. So for example, if an RDN is making a decision about what treatment to prescribe a patient with a set of medical issues, she'll want to prescribe a treatment that has a high probability of resulting in the patient getting better. Bayesian decision-making is an approach to making these kinds of decisions where the person who's making the decision bases it on as much information as possible. So in particular, they base the decision on two different kinds of information. One is prior knowledge or beliefs they have about the probability of a successful outcome in the kind of general situation they're facing. And two, new information they collect about the specifics of the situation to bring new evidence to bear on their decision. Both the prior information alone and the new evidence alone may be limited or incomplete in some respects. So it's really the combination of the prior information and new evidence that allows them to have the best possible estimate that the decision is going to be successful, and thus allows them to make the best possible decision. So to kind of go back to the example I started with, the RDN will have some general information about a patient, some of their characteristics, age, sex, race, ethnicity, that sort of thing, as well as a set of symptoms the patient reports experiencing. Based on that, she might suspect that the patient has a particular type of anemia, for example. So she could go to the research literature to find out what it says about the chances that a patient with those characteristics and that basic set of symptoms has anemia. For a Bayesian decision maker, this is what's called a prior probability, and it's based on prior information. That'll be useful in making the diagnosis, but it's limited in the sense that every person and situation is different. So there might be something about this particular patient at this point in time that makes them either more or less likely to have anemia. So the RDN in this case might collect some new evidence about the patient. So they might order some lab tests that can shed light on this specific patient's chances of having anemia. Just like the prior information, the lab tests alone won't be conclusive, but it's the combination of the prior information and the new evidence that really makes for good Bayesian decision making.
Okay, great. Thank you. Very helpful.
Great.
What is the difference between Bayesian decision making and Bayesian statistical analysis?
Yeah, that's really kind of, it's sort of about the general and the specifics. Excuse me. Bayesian decision making is all about the general approach to making decisions based on two kinds of information, this prior information and new evidence or new information. Bayesian statistical analysis is really about the details of how that's done, how those two kinds of information are combined statistically to calculate the final probability of an outcome. And that's what Bayesian statisticians would call a posterior probability as opposed to the prior probability, sometimes called the final probability. So that's really the distinction between those two things.
Okay, great. How is this methodology different from the more traditional ways that we use in terms of looking at data? Could you give us kind of a comparison and contrast of those two different types of methodologies?
Sure. The Bayesian approach to statistical analysis is different from the approach that's used by most researchers, or the more traditional approach, which is often called the frequentist approach to statistical analysis. And it's different in a couple of ways that I'll talk about. The most fundamental difference is really that the Bayesian approach explicitly incorporates this prior information or prior beliefs into the analysis formally, whereas the more traditional frequentist approach relies strictly on the newly collected data or evidence in most cases, and doesn't formally incorporate this prior information. That's kind of a basic difference. So just to take a very simplistic example, and this is an example that's often used to contrast the two approaches. Suppose a person has a coin and they want to know the probability that if they flip it, it will come up heads. A frequentist will decide to collect some data to answer that question. They might flip the coin 100 times and record the number of times that it does come up heads. And so, for example, if it comes up heads 55 times, they'll say that the coin has a 55% chance of coming up heads if they flip it. By contrast, a Bayesian will use some prior information. They'll know that if a coin is fair, there's going to be a 50% chance it comes up heads if they flip it. So that's the prior information they start out with. But they also know that there's some chance that the coin that they're looking at isn't necessarily a fair coin. It might be weighted and it might be sort of rigged to come up heads more often or less often than 50%. So they'll want to collect some new evidence about this specific coin. So they might also conduct the same experiment that the frequentist did, which was to flip the coin 100 times. And if they also come up with heads 55 out of the 100 times, they'll have these two pieces of information. The prior information, which suggested a 50% chance that the coin would come up heads, and the new information, which suggests that it's closer to 55%. So their posterior probability, that their final estimate will fall somewhere in between those two numbers, because again, the Bayesian approach is combining the prior information with the new evidence. So this is a case where it's pretty obvious what sort of prior information a Bayesian statistician might use. But that's not always the case. And a Bayesian researcher will often have to make subjective decisions about what's the relevant prior information or prior beliefs they should include explicitly in their statistical analysis. With frequentist analysis, it's not necessary to make those kinds of subjective decisions. And so critics of the Bayesian approach often sort of object to this subjective element to the analysis, figuring that the researcher is making a subjective decision that ends up affecting what the final result looks like. So in response, in doing a Bayesian analysis, a researcher might conduct a sensitivity test where they repeat the analysis multiple times, each time starting with a slightly different set of initial pieces of prior information, just in order to see how that affects their results. How much do their results really change based on this prior information? So that's one kind of difference between Bayesian analysis and the more traditional frequentist statistical analysis. Another difference is in the area of statistical inference. And statistical inference is just about what kinds of statements can you make in order to summarize the results of a statistical analysis. So just to start with an example of this, suppose a researcher wants to estimate the effect of participating in a weight loss program on participants' body weight. A frequentist analysis will typically really focus on coming up with a single estimate of that effect, and then presenting some information about the level of statistical uncertainty surrounding that estimate. For example, the frequentist statistical analysis might collect new evidence by conducting a clinical trial, and on the basis of that trial, they might conclude that the program led to a reduction of 10 pounds in participants' weight on average. So that's their main result. But they'll also report some other statistics that get at this uncertainty, like the estimated effect standard error, a confidence interval. They might conduct a test of statistical significance and also report a p-value. A Bayesian researcher is much more likely to report on the results of a clinical trial in probabilistic terms. For example, they might say that there's an 80% chance that the program led to a weight loss, or a 60% chance that it led to a weight loss of at least 5 pounds. They might report what's referred to as a 95% Bayesian credible interval, which is the interval of values that the analyst is 95% sure includes the true effect of the weight loss program. So in this case, they might say they're 95% sure that the weight loss program led to a reduction in participants' weight of somewhere between 4 and 16 pounds. Typically, they don't use p-values and tests of statistical significance in Bayesian analysis. So it's not as straightforward for a frequentist analysis to have these kinds of probabilistic statements. So proponents of Bayesian analysis view it as a big advantage of their approach, since they argue that these are the kinds of probabilistic statements that are really most helpful to decision makers or policymakers when they're coming up with a policy or have to make some kind of decision.
Okay, thank you so much. And then going back to that concept of p-values, could you describe just a little bit more the reasoning behind Bayesian philosophy and the use of p-values?
Yeah, so Bayesian statisticians don't really like p-values a whole lot, and it's not because they think there's anything that's wrong with the fundamental statistics of p-values and tests of statistical significance. Rather, they argue that p-values and significance tests that are used in frequentist analysis are commonly misunderstood and misinterpreted. The American Statistical Association recently released a statement that made just that point. So what do they mean by this? I think it's easiest to start with what a p-value doesn't mean. A p-value doesn't represent the unconditional probability that a given hypothesis is true, or the probability that the null hypothesis is false. So in the previous example, if the p-value was 0.07, that wouldn't necessarily indicate that there's a 7% chance that the weight loss program had no effect, or a 93% chance that it led to a weight loss. Instead, p-values are really reporting what are known as conditional probabilities. So a p-value of 0.07 requires you to make a set of assumptions. It requires you to start with the assumption that the null hypothesis is true. So if the null hypothesis is true, and if other assumptions that the analyst made in estimating their statistical model are also true, if the model's other assumptions are also true, then in that case, there's a 7% chance that the clinical trial could have produced the data that it did. So the idea here is that a low p-value indicates that this new evidence being produced by the clinical trial is really not compatible with the null hypothesis of no effect. So the logic of this is a little hard to get your head around, but it's kind of similar to what's used in criminal trials, where jurors are asked to presume that a defendant is innocent, but then they're presented with some evidence that may or may not be consistent with that presumption of innocence. The less consistent the evidence is with the presumption of innocence, the more likely the jury is to conclude that the defendant is guilty. So in the same way, the lower the p-value, the more likely a researcher is to conclude that there's an effect under the frequentist approach to statistical analysis. So back to the Bayesian approach. The Bayesian philosophy is that this way of thinking about statistical inference is really too complicated. It's too hard to get your head around. So they set out to kind of more directly measure the probabilities that they believe decision makers are most interested in, like the probability that a weight loss program actually leads participants to lose weight. So this approach to presenting the results of an analysis doesn't rely on p-values or use tests of statistical significance, and it doesn't require the kind of conditional probability assumptions that were required in the frequentist analysis. So those who favor Bayesian sort of analysis and Bayesian decision making believe that it's sort of really a more straightforward way for policymakers or others who need to make decisions based on the analysis for them to use the results of analysis.
Thank you. Excellent example. Many of the members of the Academy are working in clinical settings, and I wondered if you could respond to the ideas that clinical nutrition experts might be using in terms of counseling patients, and give us some of your thoughts on using evidence-based data to inform their work. In other words, how can Bayesian-driven methods be used?
Yeah. So a clinical nutritionist, for example, really can use Bayesian decision making, the basic philosophy, whenever she counsels patients. So in most situations, she'll have some kind of prior knowledge or information about a situation that might suggest some general guidance for a patient, just like in the example that I gave earlier. The patient's characteristics, description of symptoms may lead the nutritionist to make a preliminary diagnosis and suggest a treatment. So the Bayesian approach suggests that using this prior information and judgment is useful and should really play a role in an RDN's recommendations. But the Bayesian approach also suggests that she shouldn't stop there. She should also work to bring in new evidence to help improve her decision. So the evidence should be as specific as possible about the patient and his or her situation, and could provide the nutritionist with insights that aren't available from the more general prior information that she began with. So again, the prior information might be things like the results of prior research studies that looked at the likelihood that middle-aged men with a particular set of symptoms that they reported have anemia. And that's going to be an average over a large number of people. So the new evidence, again, is going to bring in new information about the patient that the nutritionist is treating. And it could come in a variety of ways. So the new evidence or information could be, like I mentioned earlier, could be a set of diagnostic tests that shed light on the likelihood that the patient has anemia. It could be a more extensive set of questions for the patient that delve into their situation in more detail. And maybe some of these questions don't have a specific research study that would tell the nutritionist exactly what the probability that symptom is associated, that the patient with that symptom has the condition that they're looking at, but it should provide additional evidence to complement the earlier prior information that they had. So it could be this more extensive set of questions for the patient. It could also involve in bringing some kinds of external sources of information, like the nutritionist might meet with family members to ask them for information that the patient himself or herself wasn't able to give. Or it could involve having the patient complete a food diary over the next week. All of those are kind of bringing in new information to help the nutritionist make a better diagnosis and make a better treatment recommendation. So I think probably one thing that's worth also saying in conclusion would be, I think that the basic philosophy behind Bayesian decision making and the basic approach is one that I think a lot of us really already follow, at least at a subconscious level. We all like to use as much information as possible when we're making decisions. The strength of the Bayesian approach, I think, is that it provides sort of an explicit way of combining what's prior information, prior beliefs, and new evidence. And it also provides sort of, if you want to get into the details of it, it provides kind of a statistical underpinning for how you combine those two sources of information in making good decisions. So it's really kind of sort of a good basis for making decisions that allows us to make decisions in a way that I think we already do at some level.
Okay, thank you so much, Phil. I think what you were just speaking about will be very helpful to registered dietitian nutritionists who are working in those settings where this kind of idea and relationship to decision making can be incredibly important. Thank you so much.
Great, you're welcome.
I also want to end with indicating that there will be a publication on this topic that Phil and Jeff Harris have written, and there are numerous monographs like this that appear in our journal that could be very helpful to those working RDNs in addition to students and learning situations in the classroom. So Phil, thank you so much for speaking with us today and for your publication of the article on Bayesian decision making that I think will be of great value to all of those working in the area of research on topics of nutrition-related ideas. Thank you so very much.
Great. Thank you very much, Linda. I enjoyed it.